Hi, I'm Zena Aldridge, Dementia Nurse Consultant at Norfolk Waveney CCG. I really don't want you to be overwhelmed by this title for this session, which is Non-Pharmacological and Psychosocial Interventions. It basically means how we can support people with dementia without using medication and medical interventions. So hopefully that demystifies the title a little bit, and hopefully as we go through the session we'll be able to offer some really practical, helpful tips on how to support people with dementia. So the aims of the session is to think about how we can improve the quality of life for people with dementia. We know it's non-curative, we can't cure dementia, but what we can do is try and help people live as well as they possibly can with the condition and have a quality of life that is something that they feel comfortable with. And to focus on what people with dementia can do rather than focus on what they can't do. We often have a very disabling way of looking at dementia and kind of think, well, they can't do this, that person can't do this, rather than going, that person can still do this, or maybe they could do that slightly differently. So I think we can all be really creative, and it gives us the opportunity to try and be creative to improve the quality of life for people with dementia going forward. Priority for this session, and as is for all dementia care in totality really, is get to know the person as best you can. Don't think that what we find is something that we enjoy is something that that person will enjoy. And don't necessarily assume that just because they had a particular occupation that that's something they want to do going forward. It's really starting to understand that person as an individual. Think about their personal and cultural background. And by cultural, that's not about talking about ethnicity, it's about a wider, broader, more concept of what is it that was important to them when they were growing up, how they lived their lives, how they conducted themselves, and what's really important to them. And don't assume that just because someone comes from a particular ethnic background, for example, that they are going to live their lives as other people in that culture might do. It's very much about really getting to grips with that individual and knowing their family background. Thinking about important life events. And that's about things that are positive, that we can talk to them about and celebrate with them, but also getting an understanding of some of those things that might be even more challenging for them. You know, people might have had really difficult traumatic experiences when they were younger that it's really important for us to know about it, because it may mean that that influences how we behave and how we support that person going forward. And often we might not know these things, family members might not know these things. So again, it's about talking to that person, particularly in the earlier stages when they're able to communicate, to find out as much as we can about what's important to them and what their preferences and routines are. I always joke and say, I'm going to be the most horrific patient in the world if you give me a cup of tea with 2 sugars, because you'll wear it. I'll spit it out straight away. I always drink coffee. Now, it may seem like a really simple thing to understand about me, but actually you could see how that could escalate. Imagine I was in a hospital scenario, for example, and they were trying to encourage me to drink plenty of fluids, and the thing they kept giving me was tea and 2 sugars. Not only am I not going to drink it because I don't like it, but I'm probably going to be seen as aggressive because I'm going to spit it out at people. So, you know, even those very simple things about what people like, their dislikes, are really, really important, and don't underestimate them. One of the great tools I like is the Alzheimer's Society This Is Me document. It's kind of taken on several iterations over the years, but actually what it's about is getting to know that individual. When I worked in the hospital, I really tried to engage people to fill these in, whether they had Alzheimer's or dementia or any other condition that might make it really difficult for them to communicate in that environment. Because actually, yes, I need to know some of their medical background, but more importantly, to be able to care for them appropriately, I need to know some really fundamental things about them. You know, their likes and their dislikes, how they take their medication. Do they have any pets? Their family members? Because when someone's distressed in an environment that they may not understand, knowing those things about someone can help me engage in a conversation. If you're in a patient's home or a person's home, thinking about some of the cues and clues in the room might be really good. Looking at family photographs, or if they've got any particular themes of books that are around, that might be an indication of something that they're really interested in. So, be creative, use those visual prompts all the time, but more importantly, get the information from the person themselves and their family if you're able to. Reminiscence is a concept we've heard about, reminiscence therapies and things like that for many years, but fundamentally it's just about encouraging people to talk about things that are important to them from their past and that they feel are important to them. So that may be about what they did for a living, it may be things they did at school, it may be things they did at work, it could be anything that's important to them. And again, it's what's important to them, not what we think is important. I've found out some wonderful things about people just by conversing with them. And everybody has so much of an interesting story to tell if they're given the opportunity. I find it really upsetting sometimes, I don't know about you guys, if you go to a funeral and actually find more about someone in their eulogy at their funeral than you did when they're alive. And it's really sad because you kind of think, I wish I'd have known that about that person. I'd love to ask them about it. This is a great opportunity to learn so much, not only about that person, but what else life was like outside of, the times that we might have lived in. Really, really fascinating. I have had people who have had really bizarre careers. I've been fortunate to work with people who were some of the first women who were in the Dagenham Ford factory, for example. Really, really fascinating stuff. Code breakers, ballet dancers, but mothers with multiple children who took on caring roles and were juggling commitments far long before any of us were doing it. So really, really fascinating. Do use that. So use your prompts to think about stimulating memories, but also think about the other senses that can do that if that person can no longer communicate. So those visual prompts, looking at pictures or looking at films, those sorts of things that might prompt to memory. But also music and sound. I don't know if you've ever come across music mirrors, but do look up music mirrors on their website. So Heather Edwards is a wonderful person who has created a means of collating some of the sounds and music which is important to that individual. So it's not the same as a playlist for life when we talk about music that person liked. These are about generating sounds that would trigger a memory. So maybe a song that was at your wedding, or the sound of a train if you worked on the train lines, very, very personal and very, very pertinent, that you can put on an MP3 player, for example, and play to that person should they be unable to communicate at some point. It really, really are very, very effective. And do think about music as a means of generating memories as well. It may be that, I'm certainly going to hope that Joanne are on my playlist when I get to an older age. Please don't put me Vera Leon on. You'll hear me talk about that an awful lot, but it's a bit of a bugbear of mine that we still seem to go into the, the early 20th century as opposed to coming into the sort of later 20th century and 21st century. And I know for certain if you played Vera Lynn to my father, he would walk out of the building as quick as you like. So again, really get a sense of what was important to that person. Think about meaningful activities. If someone's distressed or bored or, apathetic, they've got no interest in things, think about meaningful activities. And to be able to get a meaningful activity with that person, you need to know what they find meaningful, not what we consider so. So you can't just set up activities with a one-brush or one-size-fits-all approach, because everybody's going to be very different. Everybody's going to have different interests. You might have groups within that group, but ultimately you need to think about that more clearly. Think about what their hobbies were like and trying to adapt them. So absolutely, someone might have enjoyed digging up their garden and running an allotment, but physically and cognitively they might not be able to do that anymore. But they might be able to potter around in some raised flower beds or tend to some plant some bedding plants, there still might be things within the realms of their interests that they can do, rather than focusing on the bits that they can't do. Often we get a lot of ladies who've perhaps been housewives who still want to do some of the household chores, whether that be at home or in residential care. And actually it's not demeaning to give someone a duster or a brush and dustbin, for example, if that's something that they feel gives them purpose and value. Of course, you have to meet it to the right person. A good friend of mine, her mum went into a residential home a few years ago, and she used to clean the windows constantly. She was thrilled at the opportunity to be able to clean the windows. The staff loved it because it was a job they didn't have to do, but she actually really liked it. It gave her a chance to move around the rooms in the residential homes, talk to other members of the community there, and actually give her a sense of purpose. So it wasn't something that was exploiting her, it was something that was really giving her purpose and value. So we can be creative. Think about how people engage with their families, whether that be in home or in a residential setting. Often families feel that they just have to come and sit in a residential care setting. They don't often realise that they might be able to take that person off the premises for a cup of coffee or something if it's appropriate, or take them out for a walk. How can we do things slightly differently? And again, it's enabling that person to go out and spend some time with their family in a way that they can't do if they're in that constant 24-hour residential setting. So, is it that the family might be able to take them to go and watch something on the Broads, or again, give them a different perspective, looking at things they might have enjoyed. Think about activities. Risk, it's really difficult to balance the risk of people falling or harming themselves with taking positive risks about giving them an opportunity to do something physical. So it might be that actually it is really difficult for them to do stand-up exercise, but perhaps chair-based exercises. And again, if someone gets more tired, it might help with their sleep pattern. It probably helps with pain management in terms of their limbs as well. So it's not just about managing their well-being in terms of doing some distractive behaviours, but actually really doing something that benefits the whole health and well-being. Again, think about alternative therapies. A light massage, on the hands can be really, really nice in terms of engaging with someone. You can have a conversation, because it's not just about the activity itself, it's about what you can do while you're doing that activity. So while you're spending some time on a one-to-one basis, even if it's 10 minutes, you can start to talk to that person. You might paint their nails, you might put a little bit of hand lotion in. All of those things can have benefits. Music and dance. I have seen some of the most amazing responses to music and dancing within dementia care, and some of them have been some of my favourite moments. I once worked with a gentleman who was very cross with all of us. He was angry that he was in a residential care setting. He was angry that he couldn't communicate in the same way. And I remember one Boxing Day going on to an afternoon shift, and actually when I got there, who'd have known it was Boxing Day? It was like any other day of the week. So I decided to put some music on and to put some nibbles out so people could recognise it was probably a special day. And Shake, Rattle and Roll came up. And this gentleman, who always used to swear at us and was incredibly cross with us all the time, suddenly got up and went, shake, rattle and roll. And he got a couple of the other residents up and he started dancing with him, and it was like someone had flicked a switch. And I wouldn't be surprised if lots of you have experienced that with residents and people that you care for. And it is one of those moments where you really, your heart bursts and the hairs on the back of your neck really stand up. And in that moment, he was so content. But what it was a light bulb moment for us in knowing that what he enjoyed, the type of music he enjoyed, and that was often a really good distraction when he was distressed or when he was really feeling quite challenged with the environment that he was in. So there's all that learning that happens. We've got more creative as time goes on. We've got animals, we still do the pet therapy, but we've got the robotic animals as well. So if there's an infection control thing, and COVID has certainly brought that upon us, there's other ways that we can be creative. And actually I've seen some really lovely examples where people have engaged with robotic pets even. But also I've seen care home staff bring in animals that have been really, really well received. That includes eggs in an incubator, watching them being hatched, and one lady who was incredibly anxious, who got a pet lop-eared rabbit who used to spend 99% of its time laying on her lap getting stroked. And I think both the rabbit and this lady gained a lot from that. So those sorts of things are really positive. There's lots of interactive magic tables where people can really get engaged with games and quizzes and things that can really stimulate them both physically and mentally. And doll therapy. But I think one of the things to remember with all of these is, again, knowing the person and their history is really important in understanding what might be right for them. For example, doll therapy is really an important thing to remember. We don't know what person's parenting experiences might be. It might be that people may not have been able to have children or have lost children, and so we do need to think about those things as well when choosing the right examples to use. So please do not think just because it works for one, it works for someone else. Get to know that individual and their story, and it'll help you choose what you think might be best for them. The key thing to remember is when you've met one person with dementia, you have only met one person with dementia. And it's about unpicking that jigsaw of who they are, what's important to them. But seeing these sort of conversations and getting to know that person, being able to engage with them, being able to find meaningful activity as a means to reducing the distress behaviour that they may feel, or it may be that, reducing the distress that they may feel and minimising the need to medicate patients who have, or people with dementia. All too often that's seen as the first line of response, where actually it's about unpicking the pieces and seeing how best to support that person as an individual going forward.
Our first question from providers is, what are some practical examples of techniques to help support people with dementia, in particular when applying distraction technique?
The primary thing is always get to know the person. So for example, I've had many occasions, particularly in hospital, when people come in and they're really, really quite frightened, they're disorientated, there's lots of noise, they don't know what's going on. And they can be trying to get out of the bed and leave because they're frightened. And often I might be able to start having a conversation with them and go, I heard you had a dog. What sort of dog did you have? And suddenly that you're entering into a conversation of something that's familiar. And the important thing is, obviously, you need to know what's important to that individual to kind of start that conversation off, because there might be someone who doesn't like dogs. You might be saying, well, tell me about your grandchildren, or I heard this is what you did for a living. So again, try and make it as personal and pertinent to them as you possibly can. And show interest in them as a person, not seeing them with dementia, but seeing the person behind it, I think is really, really key in that. But all the time, I think it is very much about just diverting the conversation, not challenging the person's perception of what's going on. One of the difficult ones I think that everybody has is when perhaps someone's quite distressed, talking about asking for their parent or their spouse who might be deceased or whatever. And calling out their name, and people really struggle with that. They say, well, I don't want to tell them that they've died, but I don't also want to lie to them and say they're going to come, and see them at a later stage. And one of the distraction techniques I always use in that scenario is say, tell me about your mum, tell me about your wife, tell me about your husband. What do they do? What were they like? Because you're not saying they're going to come into the room, but you're also enabling them to share some really positive thoughts and responses about that individual. So, sometimes that can feel quite difficult to do, but as you're building confidence, you find it's far easier than you expect. So that person is brought to life, and you're not then saying they're going to come in, but they've had an opportunity to talk about them and share some very positive memories and thoughts. Meaningful occupation is about, say, knowing that person. What did they like? And actually, for a lot of people, particularly as they get more advanced, it might be difficult because of physical constraints as well as cognitive constraints to do those sorts of things. So think creatively. I think some of the new tech that we've got now is fantastic. When you think about how we can engage videos and we can stream anything really, can't we, about anything. We're not so constrained as we used to be, where you've got to go and find a DVD or a video. You can do it all online. You can find some fantastic things to use there. So it's about adaptation. It's about working with that individual and finding out what's best within the environment you have, because we know there's not a huge pot of money out there. We can't do everything. It's about trying to be as creative with what we have in the ways that we have it. And yeah, I think for me it is very much about think outside the box. Just think about what could we do slightly differently. I do love the robotic pets, I've got to say that. I think from a personal perspective I like them as well as a therapeutic, but it's actually quite nice for someone to just have something where they feel that companionship. And of course, I mean, some of the other wonderful things, we see actually animals going into care homes. I've seen Shetland ponies, donkeys, dogs, you name it, and the reaction is wonderful. Something that's become increasingly common is the intergenerational stuff as well. So perhaps encouraging school children to come in, or playgroups to come in, and for the older residents to see the children playing and engaging can be really positive. And actually they often engage with the children. So I'd like to see more of that happening as well, because it's not expensive, and the children get something from it as well as the residents. So yeah, think outside the box.
Our second question is, how helpful is it to answer yes or no to all questions?
To be honest, it's not very helpful, because that person's probably not going to retain the response that you've given them. So again, it's probably trying to get them off that loop. If someone's asking you repetitive questioning, it's often because they might be a bit anxious or they need some reassurance. So getting into that sort of cycle of repetitive questioning is probably not helpful for yourself or for that particular individual. So again, trying to divert that conversation into another avenue is probably important. Or perhaps saying, is there something you're concerned about? Why do you need to know? Rather than yes, no, because it's quite blunt. It doesn't kind of show any engagement. It's difficult to perhaps enter into a conversation when you're really busy and you've got to flit off and do the other things. And I understand that, but sometimes that little investment at that point might save you a lot of time further down the line. So just show some interest, I think, is probably important. But equally, if you're asking people questions, don't then ask, don't give them too many options to respond to, because if their short-term memory is impacted on, if you give people half a dozen different choices, they may have forgotten what the first choice is before you get to the last one. So think about not only how you respond to their questioning, but how you pose questions as well, I think is really important.
Thank you for watching. If you would like more information, please visit Norfolk and Suffolk caresupport.co.uk, where you'll find further training on our learning portal. The link for this website is in the description down below.